Okay, hello sir. So right now your heart is going at a very fast rate. You are in what's called supraventricular tachycardia. So what we're going to do, we're going to put you in what's called the Valsalva maneuver, and this is going to attempt to bring your heart back to a normal rhythm. So I'll explain the steps to you as we go. So the Valsalva maneuver is just something that we do for patients when they're in supraventricular tachycardia in order to return their heart rhythm back to a normal sinus. Stop. Okay, so before we start, there's a few things that we need. So first, what we need to do is, of course, don proper PPE, so we need our gloves. Secondly, what we need is we need to obtain a 12-lead ECG. So we've already done that based, you can see on the electrode position, and it's clear that our patient's heart is in supraventricular tachycardia. And thirdly, what we need is a 10 milliliter syringe. Okay, pause. Additionally, because we are only PCPs, we do not have IV certification, so we cannot actually do anything that requires IV access, so we will be skipping that step. But that was also part of the requirements for the Valsalva maneuver, but we will be skipping that step in this demonstration.
Okay, sir. So we're going to ask you to breathe into this 10 milliliter syringe as hard as you can for 15 seconds. So I'm going to be doing the count, and try to visualize as if you were to push the plunger back as far as possible, okay? So I'm just going to give this to you. And then after this process, after you breathe as hard as you can, or breathe out for 15 seconds, we're going to be lifting your feet up and raising this back and laying you supine, so flat on your back for 30 seconds, and then we're going to be returning you back to this position for 45, okay? So on my count, you can breathe in, breathe out, sorry, as hard as you can. So starting now. 15, and then back.
This is for 30 seconds. Back to seated position.
And so, sir, we're going to keep you in this position for the next 45 seconds.
You can stop.
I'm going to cut that.
Now that we've finished the maneuver, we're going to wait another 45 seconds and reanalyze the heart rhythm. If the rhythm is still in SVT, we can perform the maneuver once more. If not, if the rhythm is already out of SVT, then we're successful.